This program comes to you compliments of the Tobago Inspirational Network. To support this and other programs, we encourage you to give to TIN. Contributions can be made at any First Citizens Bank at account number 203-4679. We thank you for your support.
Good evening and welcome to today's program of On Call. I am Thalissa McClure, and of course in studio with me is none other than our resident doctor, Dr. Maxwell and Thalissa. Dr. Max, welcome to today's program.
Good evening, Thalissa. How are you?
I am good, and you?
You're over smiley this evening, like something going on.
Maybe I had some good news.
It happens, all right.
All right, Doc, I want us to talk today about a topic that is very prevalent right now. Where I am, I see a lot of it constantly, and sometimes it seems as if people aren't really aware of what is going on, and that is conjunctivitis, or as it's known sometimes, pink eye or red eye. It seems to be something that's on the increase right now, especially in Tobago. So what exactly is conjunctivitis?
Well, pink eye is not red eye, all right, but pink eye is what most of us know as the conjunctivitis, okay, and it is a condition in which there's an inflammation, an acute inflammation of the white part of the eye. When you look at the eyeball, I mean the eye, you will see the dark part, the black parts, and some people it's brown, and then the white part. The white part is called the conjunctiva. So whenever you see that area get pinkish or changes color to almost reddish, whatever, so it's an indication that it's an inflammatory process going on, and that is what is generally termed pink eye or conjunctivitis, which is infection of the conjunctiva.
So what is the red eye?
Red eye is another topic on its own, which indicates that there might be some degree of bleeding or other things that there are a lot more serious conditions that are termed under that umbrella called red eye, you know, that kind of stuff. Good? So, what makes the conjunctiva red eye or pink actually is that the blood vessels become more visible, you know, and they tend to have this almost pinkish reddish color.
So it's wrong to call pink eye red eye?
It's not precisely the
Well,
same
it's
thing.
not red eye. Okay, understood. Because I've heard some people calling it red eye. That's why I was a bit confused as to. Right. So what are the causes? How does one get
there are different
conjunctivitis?
things, different factors that could cause red eye. It could be an allergy. It could be irritations. It could be bacterial infections. It could be viral infection, which is what is common, you know. It could be other kind of, you know, chemicals that possibly make contact with the eye, and then you start to rub and, you know, irritate and itching and stuff like that, and then you have this manifestation of the conjunctiva, you know, irritation. So in terms of allergy, you could have things like, you know, things that you're allergic to, you know, sprays, perfumes, other situations that may also come with, you know, allergic component like sinus, you know, sinusitis, rhinitis, you know, things like that, in which a lot of itching and sneezing is involved and stuff like that. So that is one aspect of what called that allergic conjunctivitis.
Okay.
Then you also have the conjunctivitis that is caused by irritants, okay? Things like your chemicals, like I said before, shampoos, dyes, dirts, okay, smoke, okay, or maybe just ordinarily going in the swimming pool and you have chlorine irritation into your eyes, you know, or somebody spray something into your eyes. All these are, you know, irritants that could, you know, lead to situations like that. And you could also have a bacterial infections of the eye, which may be as a result of popular bacteria like Staphylococcus aureus, Staphylococcus pneumoniae, Haemophilus species, different kinds of bacteria that could, because some of the STDs that we also have, like chlamydia and gonorrhea, could also cause conjunctivitis.
Really?
Okay? Right, especially in the newborns, when women who have chlamydia or gonorrhea have delivery through the birth canal, the infant may pick up the germ, and they are born with neonatal, conjunctivitis, which may be due to gonorrhea or chlamydia. You could also have the popular ones that we contact every time, which is the viral conjunctivitis, okay, and this is certain viruses that, are transmitted from one person to the other, handshake and rubbing eyes and different things, and those are called viral conjunctivitis. They are usually very, very contagious, and that is what is popularly known as the pink eye.
So if it is not the viral one, then is it still contagious?
Right. If it is not the viral one, like the allergic ones are not contagious, because you have to possibly have some kind of allergy or sensitivity to the material to be, to have that. If it is caused by irritant, except you come in contact with the irritant, you may not necessarily have that. For bacterial conjunctivitis, some of them are also contagious when you touch somebody, and but they are less virulent. They are less rapidly transferred to one person to the other than the viral conjunctivitis. The viral conjunctivitis are usually very, very contagious.
So what are the symptoms of this, what are the symptoms of the conjunctivitis, especially the viral kind?
Generally, most of them will come with the same kind of presentations. You have things like a pink or reddish discoloration of the white part of the eye that we call the conjunctiva. You could have swelling of the conjunctiva as well as the eyelids, called the periorbital region. They are all swollen. You have increase in tear productions, and the eye becomes very, very watery. You have a lot of itching and burning of the eyes, okay? And sometimes the viral conjunctivitis is like you have a lot of pain and like gravels, like somebody put sand into your eyes and stuff like that. So there's always that feeling of if you have some kind of, what you call it, an irritation that goes into the eye, you just rubbing and
it feels like sand.
Like sand into your eyes, So basically, and those are the symptoms that you will see most of the time. The one that has the infective part, obviously, you will see a lot of mucus discharge and sticky eyes, the swollen and they glue together, and have difficulty opening the eyes, They also tend to have a lot of pain when you expose the eye to sunlight. So we call that photophobia, okay, and stuff like that. That means excessive sensitivity to light, okay. So basically, by and large, most of the symptoms are,
Is there a demographic or a group? I'm asking because this is one of the questions that people ask. Is there like a particular group of people who are more susceptible to pink eye?
The children are a lot more susceptible because of their habits, in terms of they're not able to carry out hygiene practices by themselves in a very efficient manner. So when you have like preschoolers and primary school students and anybody in highly dense and populated area, schools, offices, and other area where you have a lot of people, you have dense populations, these infections will travel very rapidly because people will touch each other. They touch doors, they touch telephones, they touch, possibly from the bank, you touch money and different things that other people come in contact with. So there could be hazards in the offices, families, nurseries, preschools, and other institutions where there's a crowd. So the children are a little more more at risk because they tend to not understand the importance of hygiene. So usually when that happens, you realize that the teachers tell them to keep them in school as a precaution, keep them at home, and don't bring them to school until they recover, basically, because it's a public health hazard.
Right. What, in terms of treatment, okay, before we get to treatment, so basically what you're saying is that you need to make sure that you keep your environment sanitized, whether it's Lysol spray, wipes, what you call it, hand sanitizers, whatever, to ensure that it's not transmitted.
So it's a lot of preventive or precautions that you need to take whenever there is an outbreak, especially the viral conjunctivitis. Okay, you need to avoid sharing makeup, especially in women. All right, people who say, okay, I have a little powder here, and you want to share because their face shiny or whatever, or you have a little eyelashes that they want to share. That could be very dangerous whenever there's red eye. Okay, do not touch or rub the infected eyes because you possibly will transmit virus from that eye to the uninfected ones. Okay, hand washing with soap and water is very important every time that you either touch your face, touch your eyes. Whatever there's any discharge, like we said, you will have like positive discharges into the corners of the eye. You need to clean that and dispose of whatever you used to clean it immediately. Do not have a handkerchief to clean it now and then you put that in your pocket, hoping for another half an hour, 1 hour, you're going to take out the same handkerchief and use it again. Okay, bed linings and pillowcases.
Well, I was now going to ask you, but what about sharing the bed with others?
Right, so bed linens and pillowcases, okay, those things you will need to make sure that they are thoroughly washed and you reduce the sharing of those things. Avoid common utensils, like towels, like I say, handkerchiefs, glasses, okay, because you could easily transmit the germs with that.
But through the hand? Through the hand,
yeah.
okay.
All right, wash hands after applying eye drops or ointment to your eyes, okay, even if you help somebody to apply it, okay, because some people may not be able to do that, maybe like the child or the elderly folks, you help them, so you need to wash your hand immediately. And if you have pink eye especially, you need to stay away from public exposure like schools, on the job, okay, and other crowded spaces because you're going to transmit it to other people.
So you can get sick leave for pink eye?
Usually, those are part of the thing that will cover your public health hazard thing, so you can be given sick leave in lieu of you having that kind of problem. Just like you have chicken pox, you're supposed to stay away from people. So,
but you said something that I didn't know, Doc, that it's possible for one eye to have it and the next eye not together.
Right, it's not all the time that you will have a bilateral involvement of the two eyes having conjunctivitis. So you may have something on one eye and it's not spreading to the other eye. So you limit the exposure by making sure that whatever happens here does not cross here. Okay, so once in a while you may have that, but by and large most people do have both eyes being involved because there's cross contact.
I laugh because I had it twice and I know both times. I had it in both eyes. Of course, this is when I was much younger and I guess you weren't paying attention to the safe hygienic practices, so somebody had it and you're liming around with them and next thing you know you end up picking it up. But I don't think at that time I realized how important it was just to make sure you always wash your hands with soap and water before.
Yeah, and that's what most people take for granted. It's not only in school. Like, children, they always have to play with each other in class or during lunchtime, so they don't have the inhibition to say, look, I have something, so don't share with other people. They're very oblivious. They just play with everybody, so they easily transmit it to one another. But also in adults, you have people just walk into offices, they have red eye, and possibly because they really don't want other people to know, or they don't want to stay away from work, or because for some reason they're on the job, okay, now, but they don't even know that it's red eye they have. They just feel something is now beginning to come up, and they have that. And they touch telephone, they touch files, they touch money, they touch pencils.
And you're oblivious to it.
You don't know yourself, or you just come to work and you shake them, okay? They just possibly use their hand to rub their eyes just now, and then you shake them, you pick up the virus, and you go your way. And then the next thing you realize,
you end up, you have it.
Where did I get this from?
All right.
And that is what is happening in most
Let's go to a quick break. We're going to come back and deal with treatment after these quick messages. Viewers, we'll be right back.
Hi, I am Petunia King Dillon. I'm your host of Family Matters, which is aired every Sunday evening from 7:30 p.m. for 1 hour. Be viewing Family Matters. It's a program that brings stability, healing, deliverance, and reconciliation through the Word of God. All the honor and the glory goes to God. So be viewing Family Matters. God bless you.
Holiness unto the Lord, every Saturday at 6:30 p.m.
Okay, welcome back to today's program of On Call. Today we are dealing with conjunctivitis or pink eye, and that's something that I see is happening a lot recently in Tobago. And so Dr. Max was just telling us that, in this case, prevention really does save the day. Promoting hygienic practices in terms of washing your hands with soap and water when you touch stuff, especially before it comes in contact with your face, can help save you a lot of stress and time. But Doc, before we went to the break, we were speaking about, sometimes even an adult may not be aware of what is happening, and so they come into work. But I've known people who try to hide it, whether they were cognizant of it or not, but try to hide it with a dark glasses,
shade, yeah.
right? So they come to work in these dark shades, and you're not sure what's going on with them, and they have this thing on all day, but you see them, they touching, they everything. I mean,
Right. I'll tell you a story. When we were younger in school, red eye or pink eye, as we call it, conjunctivitis, in Nigeria, we used to call it Apollo. Okay? Apollo, is the people who went to the moon. They have this kind of big
glasses.
Glasses, So we used to say, hey, you have Apollo, So once you have that glasses on, everybody say, hey, you have Apollo. So when you're red, your eyes get red like that, okay, hey, don't touch me, you have Apollo. So it was a way of describing, conjunctivitis. So we call it Apollo. All right. People do that a lot, and they come with the glasses or sunshade, as we call it, and they all over the place. So if you don't know what is happening behind the eye, okay, I suggest that you restrict your handshaking. Okay. I've seen most people share their hand to shake me like this, and I deliberately will do so. Give them a bounce, because maybe in a twinkle of an eye, I'm not too sure
what's going on.
So, but at least to be courteous, you get a bounce, and that's acceptable, so no problem. So that's another way of getting away from shaking people if you don't know what is going on,
But what about shaking and then immediately, as soon as they turn the back, you go and you wash your hands quickly?
Well, that's another option, but that may not always be possible. So you're going in a place, you're not in your car to say you have hand sanitizer or whatever, somebody shake you, and you go, or you take cash from somebody, you don't know what they have, and things like that could happen, So, but as much as you can, maybe you have wipes ready. It's highly, it may not always be possible for you to have a wipe or a hand sanitizer everywhere you go. I mean, you always keep some in the car or maybe in your office or at home, but it may not always be possible. So the best thing is to be prepared.
Doc, can you get sympathy conjunctivitis? When I say that, I mean, I find sometimes you're exposed to an environment and you realize that, this is what's going on. And all of a sudden, you feel like if your eyes start itching, or like if you're getting the gravelly feeling in your eyes.
No, that's more like mind over matters than anything. If you do not have active contact that the virus gets on your body, if you don't make direct contact with the person, it's highly unlikely that you will get the illness or the disease. So somebody will have had to make contact with you, or you shake somebody, or you touch what they have touched, or you do something, and then you transfer that germ
to your face.
That's when you will get things like that. Apart from children who possibly, or infants who will get that, or chlamydia, herpes, and gonorrhea during childbirth, where they pick it up from the vaginal tract, usually you have to make contact to get it.
Yeah. So what are the possible treatments for conjunctivitis?
Okay, the treatment of conjunctivitis really is dependent on what is the cause. Okay, we have identified about like 4 or 5 types of conjunctivitis, okay. If it is as a result of irritation, okay, the main method of treatment for that is to use like just regular water to wash the eyes, chemical irritant, acid or alkaline. They should be thoroughly washed with water, okay. And then after that, if you're still having any concern in terms of how you feel, then you will contact the eye doctor to have a thorough examination. In terms of allergic conjunctivitis, the removal of the allergen or whatever is the causative agent at that point in time that is causing the allergic response will resolve the matter, and then you can use some antihistamine, which is anti-allergy medication, to get rid of whatever residual feelings or symptoms you may have. In terms of bacterial conjunctivitis, most of the time we need to use some antibiotic, eye drops or ointment and stuff like that. And usually within 24 to 48 hours of using these things, the symptoms will start to subside.
The eye drop, does it have to be antibiotic? What about the Visine clear eyes thing?
Right, some you can use in addition to, because Visine and clear eyes or tail, whatever, is just really water that mimic the
natural tears.
Lacrimal gland secretion. We try to soothe the eye and prevent drying eye and pain and stuff like that. So, but once it is as a result of a bacterial infection, you would need an antibiotic to kill the germs. All right. Now, in terms of those that are caused by viruses, okay, there's absolutely no specific treatment for that. So most of the red eye that we have, or the pink eye that we have, as you say, they are viral in nature. They normally would take their course, 3 to 5 days, at most sometimes 7 days. Even sometimes without treatment, they will eventually,
go by itself.
Your body will play the virus, and eventually they will go away. But the only problem then is that they are highly, highly contagious, and during that time, you need to take certain precautions so that you don't transfer them to other people. Yeah.
That's it. Okay, could by chance, is there any random possibility that somebody could probably get blind from conjunctivitis?
That is highly irregular. It's not common. However, pink eye can be complicated at times with scarrings of the cornea. Okay, it's another part of the eye, another eye structure that could get, scar formation behind it, and this can damage your vision. Okay, so it is important that you seek medical help whenever you have this thing, because you never know when the infection is going to be severe enough to cause scarring of your, cornea and lead to some kind of visual problems and complication within your vision system.
Okay, so rather than just stay home and wait for it to pass,
it's always good to get it checked out. So ascertain what the cause is, and then so that doctors can apply appropriate treatment.
how soon after can you return to work or school or so?
Usually, this takes about like 3 to 5 days most times to clear up. Okay, it's only in extreme cases you might go up to like 5 to 7 days, but by and large, most times you get about like say 3 to 5 days, you should clear up.
So would you need like a doctor's note, a medical or something to go back to work or school?
Usually, once you have conjunctivitis like that, they give you a sick leave to really, it's really for you to stay away so that other persons can be protected really, and after that they may need you to say, okay, fit to go back. Some institutions will require that, so you go back to the doctor and say, okay, well, look, this is improved significantly enough for you to go back to work and you're no longer a threat to the public.
So for instance, all right, if you're in a household, you would have had conjunctivitis, so you're staying away from work or school. How do you minimize the exposure to those around you to ensure that they too don't become infected?
Right, basically the same procedure and precautions that you would take around, okay, the hand washing, minimizing sharing of utensils, washing of your bed linens, and regular washing of your hands when you go to the toilet, or you turn a knob in the door, or use common telephones. You make sure that you wash your hand, and the other people wash your hand when they come in contact with you, basically, and that is basically how to minimize your risk. In terms of mother, child, husband, wife who sleep on the same bed, well, it's really difficult to say isolate yourself, but they can also minimize their risk by minimizing their contact with you. I've seen some people say, look, that's my husband, I'm going to stay on the same bed with him, and they never really got infected, but some, they share it all around, from child to mother to auntie to everybody. They share it, and everybody take the round having it, and some people, in anticipation for that, they bring everybody one time and say, okay, we'll just give us something to prevent whatever it is. Okay, so we can't be treating what is non-existent. So I always tell them, look, it's only when you show symptoms that we start to treat. So the decisions are based basically on the individuals and how they perceive it. Some people decide, okay, look, I'm going to lock up my husband and my wife in the room by themselves. When they get better, then we will interact at that level, So everybody.
No, but it's not that strange, Doc. Because it's not that strange, because I remember, what did I have? Chicken pox.
Right.
I had chicken pox, and I took it upon myself. I took a mattress and I separated myself from everybody because I didn't want anybody to get it. So I kept all of my laundry and everything apart from everybody, and I was the only person in the house with it. Okay. And when that time passed, that was it. Nobody else got it.
That is the best thing. That's self-isolation. So you isolate yourself, or you quarantine yourself within the household. That is the best option, okay, other than expose everybody, Some people, they love each other so much, they mind to get chicken pox if their husband have it, but that's fine, but everybody is different.
So, well, Doc, we're out of time. Is there anything else that you think people should know about conjunctivitis before we wrap up the program today?
Well, basically, that is whenever you think you have any of the symptoms of conjunctivitis, be careful enough to check it out, okay? So that we know what you're dealing with, and don't just take things for granted, because some of them could really have some visual consequences if they are not properly managed and treated.
All right. Dr. Max, thank you so very much for your time today. And viewers, thank you for tuning into today's program of One Call. Of course, I'll see you again next week, same time, same place. Have a blessed week. Bye for now.
This program comes to you compliments of the Tobago Inspirational Network. To support this and other programs, we encourage you to give to TIN. Contributions can be made at any First Citizens Bank at account number 203-4679. We thank you for your support.